Namaste to all. Welcome to Easy Ayurveda Gurukula episode 24. Welcome to all our participants, Easy Ayurveda family, to this particular session. Today we have Dr. Vishnu Priya with us. So on behalf of all of us and Easy Ayurveda, may I take the privilege and honor of welcoming Dr. Vishnu Priya to Easy Ayurveda Gurukula. Dr. Vishnu Priya, namaste and welcome to Easy Ayurveda Gurukula. So before I hand it over to Dr. Vishnu Priya, may I briefly introduce our guest speaker to all of us. So Dr. Vishnu Priya Sitaram, so very good teacher and Ayurveda practitioner, today amidst with us. So presented many papers at various state, national and international seminars and conferences related to a wide array of topics, including aortic arthritis and other diseases. So mainly, I would like to highlight a paper, so that is which was presented on the topic Ayurveda management of Chagas disease, with special reference to Krimi Hridroga, which was awarded as the best paper, and also Ayurveda management of Bell's palsy with Lashana Rasayana, that was also considered for the third place amongst wide competition. So Dr. Vishnu Priya has published many articles in various journals related to Bell's palsy, Amavata, multiple system atrophy, etc. So that shows a researcher in Dr. Vishnu Priya and also an explorer. So going deep into the Ayurvedic basics and also dealing with many diseases clinically with Ayurveda basics, treatments, therapies, and medicines and lifestyle modifications. So currently working as assistant professor in the Department of Thai Chikitsa at Dhanvantri Ayurveda College, Siddhapura in Karnataka. So today, Dr. Vishnu Priya will be presenting a case study. So as a part of the presentation, the topic will be Ayurveda management of plantar psoriasis, a dual case report. With a brief introduction, without wasting any time, let me hand over the dais to Dr. Vishnu Priya Sitaram, so to take over and present her case. So Dr. Vishnu Priya, go ahead. Thank you.
Thank you, sir. Thank you, sir, for the warm welcome. And good evening to all the participants of this session. And I'm actually having this good privilege to be part of this EC Ayurveda family. So without further delay, let us move on to the topic. So without further delay, let us move on to this topic, which is Ayurvedic management of plantar psoriasis, a dual case report. So here I'll be dealing with a case report where the patients are actually the siblings of the same family, and they had shared the same history and same clinical features. So I just wanted to try the same medications in both of them, and interestingly, there was some remarkable improvement in the symptoms. So I just thought to present that as a case here. So moving on to the contents of today's presentation, I'll be dealing with the brief introduction to psoriasis and the skin layers, and also about what exactly is Palmo plantar psoriasis, the etiologies that may cause this, and the triggering factors of it, and the dual case reports, as I have mentioned, and the intervention that I have used in this particular case, and about the probable mode of action of this intervention and the conclusion of this entire PPT. So that is it. So here, talking on to about the Palmo plantar psoriasis. This is a form of psoriasis that affects the palms of the hands and also soles of the feet, as the name suggests. And the characteristic feature of this Palmo plantar psoriasis is about the epidermal hyperplasia. That means the number of cells present in epidermis will get increased, and along with that there is dermal infiltration of immune cells. That means the immune cells also get increased in the dermal layers. So that is the characteristic features of this kind of psoriasis. Okay, so psoriasis, there are different types of psoriasis. As we all know, there are erythrodermic psoriasis, maybe scalp psoriasis, nail psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis. So there are different types. So today's topic of discussion would be Palmo plantar psoriasis. That is why I have not included any of these in this presentation. So basically, in the psoriasis condition, there would be formation of plaques. So what exactly is a plaque? Plaque is actually a well-circumscribed, solid, elevated lesion which is more than 1 centimeter in diameter, length being more than the depth of the lesion. So that is the basic description about what exactly is a plaque. As the slide presents, there is a figure presented here. So here it shows about the different layers of the skin and what are the presentations. So here at the topmost layer, which is the epidermis, you can see the old dry skin flakes. So this is the particular or characteristic feature of plaque psoriasis. So here there would be dry skin flakes on the epidermis, and in the dermal layers and in other layers there would be thickened epidermis, and then there is also overproduction of white blood cells. So these are the basic things that can happen in a psoriatic lesion. So now telling about what all are the etiologies that may cause psoriasis. So one thing is immune stimulation of the epidermal keratinocytes. So whichever sites or whichever cells are present in the epidermis is known as keratinocytes. So when there is any kind of immune stimulation due to some kind of triggering factors or something, some infections or whatever it is, so this may actually trigger the immune response in that, and there may be some changes in that sites. So that is the one of the cause for psoriasis. Another cause is family history. So family history in the sense, if the person has any first degree relative or second degree relatives of the same complaints, there might be chances that the person is getting susceptible to this disease. So that is one thing. But still the person is saved if at all the person is resorting towards Patya, Ahara and Vihara, then there is no chance of developing the disease. But in case if he or she fails to do it, then there is always a chances of popping up of this psoriasis condition. So that is one thing. And recent researchers have proved that there is always chances of developing psoriatic lesions if the sibling of the family is having this complaint. So that is one of the recent researches that has happened. Okay, now talking about the genes. So there are several genes also that may cause gene mutations that may happen that results in psoriasis. Like for example, HLA-CW6 is one type of gene mutation. And also talking about human leukocyte antigens like HLA-B16, 17, 27, 39. All these are triggering factors of this psoriasis development. And lastly, it is the environmental triggers that can cause this psoriasis. So talking about the triggers, what exactly is a trigger? So trigger is the thing that is the exact cause for psoriasis. So basically, if a person is susceptible to psoriasis, but still if they resort towards Patyahara and Viharas, there is no chance of developing this disease, as I said before. But if there is any kind of triggering factors, like say injuries, sunburns, or any kind of infections, then there is always chances of popping up of this recessive thing that was present in the body. So that is known as a trigger. So here, talking about the triggers of psoriasis, it might be injury. So injury, it doesn't mean like it is a blunt injury or a sharp injury, no, or external trauma, no. The injury that is mentioned here is about the scratch or itching kind of actions that the patient does and cause the removal of the plaques or whatever, and it may trigger the psoriatic lesions. So that is one trigger. Second trigger is about the sunburns. So sunburns are also another cause for psoriatic lesions. So sunburns, as the complaint says, it is caused due to the excessive variations in the temperatures, and this may leads to the variations in the skin as well, and that leads to the psoriasis. That is another trigger. Third thing is about HIV infections. So as we all know, if there is HIV infections, there is always chances for getting immunocompromised. So if the immunity is reduced, then again, yes, there is possibility for developing a psoriatic lesion. So that is it. Then fourth is a beta hemolytic streptococcal infection. So while asking for the history of this psoriatic lesions, we need to specifically ask if the patient has undergone or underwent any treatment in the past for any of the streptococcal infections. If yes, then again we have to think that the immunity might have been reduced due to the medications or because of the infection, and that might have led to the development of the psoriatic lesions. So that is it. Now talking about the medications, in medications, it is always like there are some patients who have developed psoriasis after the taking of beta blockers or like lithium medications. Lithium medications are used in psychiatric complaints. So after the lithium medications also, people develop psoriasis. And the corticosteroids history. So all these things are triggering factors for psoriasis. Then telling about the emotional stress is last. We should not avoid the asking of this emotional stress in psoriasis patients. So there might be some kind of emotional stress that they will have underwent in their previous days, or it may be due to the mild psoriatic presentations which they were stressed about, and later on it had turned to be a chronic case, and the emotional stress also might have doubled up because of these external appearances. So there may be a number of reasons why they are actually having this emotional stress. So that is one triggering factor. Then is about the alcohol or tobacco smoking. So this is also yet another cause for the psoriatic lesions. And last but not the least, it is the obesity. So obesity also is another cause for psoriasis, because when there is obesity, again there is immunity being affected in many ways, and that is also another triggering factor for psoriasis. So basically all these causes are actually reducing the immunity, and that is actually triggering the psoriatic lesions. So that is it. So moving on to the extensive pathology of this disease. So I have already mentioned what all are the triggering factors. So it might be a trauma, infection, stress, whatever. So it may affect the keratinocytes. So keratinocytes are the cells that are present in the skin layers. So these keratinocytes are getting stressed, and because of that, there would be an activated dendritic cell, and this produces these cells like TNF, which is tumor necrosis factor alpha, and interleukins 17, all these things causing inflammation. And because of this inflammation, there is always a chance of developing immune cells, and like increased number of immune cells. So because of this immune cells increasing in the number, there is always a chance for cytokine production, and this cytokine production activates the keratinocyte division, which is the increase in the number of keratinocytes. So that is what is depicted in this picture. The keratinocytes number has been increased, and at last there will be formation of the plaques, which I have already mentioned previously. So the plaques are also formed. So this is the entire pathology of psoriasis. So now we'll move on to the case. So this is actually a case of, I said, there is two siblings, and they were complaining of the similar kind of presentation, clinical presentations, and that is why I have clubbed the case into one. So the main complaint was patients were complaining of dry flakes below the feet associated with severe burning sensation and pain since 1 month. So that was the presenting complaint. So talking about the associated complaints, they had disturbed sleep, loss of appetite since 1 month. So that might be probably because of this burning sensation and pain. And talking about the history, the patients aged were 11 years and 13 years, apparently was well before 2 years of their age. And then they started developing the dry flaky lesions which come off the skin on wearing socks or putting off the blankets. So that is one thing that they have revealed. And after that, they had approached many of the allopathic physicians and homeopathic practitioners as well, but they just found some symptomatic relief. Apart from that, they didn't have a permanent relief from this condition. And the condition exacerbates more, and when the condition is exacerbated more, they present with severe kind of pain, intolerable, such that they could not place the feet also on the ground. So that was it. And they have specifically mentioned that this complaint aggravates during the monsoon seasons and winter seasons as well. And the symptoms reduce after the above said seasons are gone and the next seasons have come, but not fully absent. So that is one thing that they have revealed. So talking about the personal history, they were saying that their appetite has been reduced and they were resorting towards a diet which is a mixed diet. Mixed diet in the sense they have the habit of taking both non-veg and veg foods. So that is one thing that they revealed. Talking about the bowels, it is soft, regular stools, and the sleep was disturbed, probably due to the pain, and micturition 5 to 6 times a day. Habits, nil, And talking about the family history, there was no history of any skin ailments in any of the family relatives apart from the siblings. And talking about the medication history, as I've said, they had met many allopathic physicians and all. So they were given with some corticosteroid topical creams, and along with that, they were administered with the cetirizine tablets as well. So before moving on to the diagnosis, let me say, before thinking about the diagnosis of any condition that is pertaining towards the field, we need to consider many diagnoses apart from these plantar psoriasis. So what are they? Allergic contact dermatitis, athlete's foot, capillaritis, chilblains, cracked heels, diabetic foot ulcers, deshydrosis, erythema multiforme, exfoliative keratolysis, fungal infections, gout, hand and mouth disease, juvenile plantar dermatosis, discoid eczema, Palmo plantar keratoderma, photosensitivity, psoriasis, tinea pedis, vitiligo, viral warts. So all these things have to be considered while considering the treatment for Palmo plantar psoriasis or whatever that is pertaining towards the feet. So apart from all these diagnoses, I have chosen the diagnosis to be as plantar psoriasis, and the reason behind choosing it is the two signs that is being depicted in this picture. So these are the two crucial signs that is available in a psoriatic lesion. So one is the candle sign. So as the picture rightly depicts, it is the like if a lesion has been scratched, or like if it has been irritated by some of the instrument, we feel some candle grease kind of substance is sticking towards that instrument. So that is the candle sign. And telling about the auspich sign, so when the lesions are actually rubbed, or if the flakes are being just pulled off, then we can see some bleeding spots on that area. So that is about the auspich sign. So being in a online consultation with these patients, I could not elicit this individually and personally, but I had told them to do this and elicit me the signs, what they have felt. So they have revealed that these, as per the reports from them, it was found that the candle sign and auspich sign was positive, and that is why I have concluded the diagnosis to be as plantar psoriasis, which is Kshudra Kushta as per Ayurveda. So considering their age and also the palatability of the medications, and it was a chronic condition as well. So in order to convince a patient having a chronic psoriatic lesion is also a very big tough situation also. So considering the palatability issue, I didn't go for some internal administrations also. So I just opted for some external medications. So external therapies was, one thing was Trifala Kwata Parisheka, which was done for 30 minutes, followed by Shadadautagrata application. So the rationality behind choosing Trifala Kwata Parisheka was because of the good properties that Trifala Kwata has. So Trifala Kwata is considered to be having a very good antimicrobial activity, and it is also a good antioxidant. So antioxidants are also necessary for keeping the skin healthy. So that is one thing. Another thing is like it is Tridoshahara. So that is one another aspect. It reduces the inflammation. Anti-inflammatory properties are also there for Trifala Kwata. And opting for Parisheka. So why exactly Parisheka was chosen is because Acharyas have mentioned that we need to choose Parisheka when there is Pitta Prakopa. So when there is a Pitta Prakopa condition, we need to choose Parisheka instead of other treatment procedures, because that is helping in the Pitta Shamana. So that is it. And it was done for 30 minutes. The rationality behind opting that duration of the treatment was because this helps in two things. One thing is to let the plaques, whichever loose plaques are there on the skin, that will be let off. Another rationality was behind the thing that Trifala Kwata helps in taking off the plaques, and also it helps in softening the hardened areas. So that is one thing behind choosing this Parisheka, and that too the span was opted for 30 minutes. So after this Parisheka, I was telling them to mop the area and also to take it with a dry cloth. So that was done, and it was to let to dry out for some minutes, like for 10 minutes or so. And after completely drying the lesions, I told them to apply the Shatadauta Grita. So the basic reason behind choosing Shatadauta Grita specifically is because of the immense properties that they have in Shatadauta Grita. So as the name suggests, it is Shatadauta, which is it is 100 times washed with the water. So because of the normal grita that has been washed 100 times, what happens is like the potency is increased. That is one thing. Another thing is the Shita Virya of the grita is also being multiplied because of each time the grita is being washed with water, it is getting multiplied. So that is another reason. And the other thing is like Shatadauta Grita is usually prescribed for Pitta Shamana and Pittaja conditions. So wherein there are traumas or like if there is some burning sensation. So in all these conditions, we can suggest this Shatadauta Grita application. So basically in this condition, the patients both have revealed about the burning sensation and also the trauma. And that was the reason behind choosing this application. So see, this is the improvement in the patients. So both, so this is the younger sibling and this is the older sibling. So in the younger sibling, it was a less severe case. So before the treatment procedure, it was like this. And after the treatment, it was almost nil. So that was it. And the patient has also told that their sleep has improved. The pain is no more, and they can happily wear the socks and blankets and all these things. So when the blanket was removed in the morning, they found that the plaques were there previously, but now after the treatment, they can no more find it. So that was the improvements that they have said in person. And talking about the elder sibling, so he had a more severe case in which there were more thickened scales as well. So in this also there was a drastic improvement in the symptoms and also about other symptoms like the burning sensation and the cracking and coming out of these plaques. All these have reduced very much in a good way. So this is one of the scoring system of plaque psoriasis. So if the score is 0, it is almost the skin is clear, then there would be no signs of plaque psoriasis. And if the score is 1, it is almost clear and there would be mild erythema and scaling. If it is 2, it is coming under the mild category, and there may be light pink erythema with minimal scaling with or without pustules. And the third score corresponds to the moderate category, and in this there might be dull red, clearly distinguishable erythema with diffuse scaling, some thickening of the skin with or without the fissures, with or without the pustule formation, all this. And in the fourth category, it is the severe category. So here it might be like deep dark red erythema with obvious and diffuse scaling and thickening, as well as numerous fissures with or without the pustule formation. So as we have seen in the previous slide, so this was a less severe case and this was a more severe case. So the grading was actually 4 in one case and 2 in one case. So both has come down to 1 and 0. So that is the improvement that I have seen. So this was just a short case presentation of both the siblings, and I had found a drastic improvement in the symptoms and all the things that they were complaining about, just because of this external medications. Though I have not administered them any of the internal medications, I could find very much surprised effects. So that is one thing that I have to highlight in this presentation. So that is about the whole presentation. Thank you.
Thank you, Dr. Vishnupriya. So that was an interesting presentation. So that was a good short presentation. So these things open up the pathways for many of us to experiment. See, as already Dr. Vishnupriya has mentioned, this case falls under the Kshudra Kusta. So there are variants of Kshudra Kusta, 11 as many as in number, and so it's a confused format to identify and classify the Kusta under Mahakusta and Kshudra Kusta and all those things. Kshudra means small, and Kusta means the skin diseases in general. So there is another classification called as Mahakusta, so which are 7 in number. So Maha indicates big or large, so probably covering a larger surface area. Kshudra Kusta or smaller lesions, they may be multiple, still widespread like psoriasis, but the lesions may be smaller. So that was the classification done in the Shastra. That doesn't mean that if the lesions are smaller and less scattered, so they are easy to treat. Many times we find that Kshadrakustas are very difficult to treat as well. So this is a brave attempt. One, after having seen the patients online, so Dr. Vishnupriya has taken a courageous attempt there. And they were also kids. I think they were 11 years siblings.
Yes.
Both were 11 years, twins.
No, sir. One was 11 years and other was 13 years.
11 and 13 years, absolutely. So here, so it is very interesting to see the age also, age in which these. Why do you think, Dr. Vishnupriya, that this condition manifested in the kids of 11 years and 13 years, and how common it is to see that in that particular age group? I'll come to the summary of your presentation.
Sir, actually, I had asked them about their diet patterns. So I just asked about whether they are consuming more of the amla aharas or katu aharas or dadi sevana. So none of the things were actually accepted by the patient or patient party as well. So they don't consume such kind of things. So I just excluded all those causes of psoriasis and kushta. And I think it might be because of the immunity. They had some streptococcal infection in the past. This one, so they had told that there is a streptococcal infection, but they don't have any investigation reports that suggest that it is a streptococcal infection. So I think that it might be because of that infections or their reduced immunity that might have triggered this psoriasis in them. And both of them were presenting with the similar presentations. And I have also asked about any other positive responses from their family, like if they had something that is similar in all those family members, but they denied such kind of things, like sharing of clothes or sharing of other things. So those things also were denied. So I could not trace out any other triggering factors apart from this infection or this reduced immunity. That is it.
Okay, so that was a nice information. Sopraji, you can go ahead and interact with Dr. Stuti here.
So, if you take the case, the treatment part, you only applied like Parishika and Lepana of Shatadauti. But if you think about the Gati and the Marga, it's going Tiriyak and the Bahe Marga. So, would you go with the Abhanga and Svedana, something like that? If you see the gunas, like dry and katina kind of thing. So do you go with the Abhyanga or no?
So here I have dealt about the Palmo plantar psoriasis, and still in Palmo plantar psoriasis there would be presentations in the palms as well. But in this particular case, it is only confined towards the feet aspect. So we need not go for a general Abhyanga and Svedana. That is not required. And if the patient is cooperating, then okay, that is also possible. But in my case, it was actually I didn't want to do that and make it a complex thing, because it is already a chronic case. Another thing is they are children, they're school going kids. So to follow this on a regular basis is also another tough thing. So I just opted for the local Abhyanga and Svedana. So here you might be thinking about what Svedana I have done. So Svedana has different categories. One of them is this Parisheka. So Parisheka is chosen for Pittaja conditions specifically, whereas there is no rule that it should be very much hot in temperature. The liquid that we are pouring for this Parisheka should not be very hot. Instead, we can choose lukewarm or like normal temperature also, it is fine. But the action is the same. So that is it. And Abhyanga, instead of the whole Sarvanga Abhyanga, I have chosen for the local Abhyanga. So this local Abhyanga is done with Shabadauta Grita. That's all. I just chose Grita instead of Tailas. The reason behind is because of the good moisture content retaining capacity of Grita compared to Taila.
So good answer there. Yeah, coming up to the summary of Dr. Vishnupriya's presentation. So always there is a fear factor when we are dealing with some skin diseases. That too, when the parents have tried a lot and they're not able to get the appreciable results what they were. So because parents are always concerned about the kids, here the basic intellect of the physician will be challenged. So we will be tempted to use more and more medications like a brisk and fast approach. We also see that the kids in that particular age tolerate well certain medications, and also seeing that the age group, the healing will be quicker. So we can go with a little aggressive approach with softer medication, seeing the child age group. With oral medications, external therapies, and lot more things, even doctors will be tempted to go to the level of Virechana and other conditions. So this was a brave attempt. That's why I called it as a brave attempt. Just trying to give a parisheka to flush off the flakes, and also plenty of Triphala has plenty of healing properties. Shatadauta has magnificent healing properties, we know. So over the Triphala Seka, so when Shatadauta Gruta is applied, Shatadauta Gruta is ghee which has been medicated or washed for 100 times. Shatadauta, 100 times washed ghee. So with I'm not going into the details, so we can share the medicinal properties later. So this is about Shatadauta Gruta. It has immense medicinal properties. Triphala Kashaya, as Vishnu Priyaji was telling, so it is a decoction format which is prepared using Triphala. So three basic fruits we use there: Terminalia chibula, that is Haritaki; Terminalia bellerica, that is Bibitaki; and the very famous Amla or Emblica officinalis. So these three are taken, and its decoction is prepared, and that decoction is used to wash the wounds. So here, once again, I want to come back to Dr. Vishnu Priya and know how was the Kashaya prepared? What was the quantity of Triphala taken, and how much reduction? So because you were not preparing the medicine for the patients, the parents were preparing. So your role will magnify there when you are directing the parents to prepare something and administer it to the kids. So what was the proportion of water taken? What if we are doing parisheka? You know, Triphala Kashaya can also be taken for internal consumption. When we are doing parisheka, what quantity of water should be taken in comparison to the drugs or the herbs, and how much it shall be reduced?
So there is the format of, like, we can always choose the freshly prepared kashaya. Yes, that is also possible. Otherwise, we can opt for the ready-made kind of kashayas also. So here I have opted for a Triphala powder that is readily available in the pharmacy, and I just told them to mix it in the normal lukewarm water and just do the parisheka. That was a simple procedure to say it via online medium. That was one thing. Another thing is about the tight schedule that the parents and the students were having. So because of that tight schedule, they may not be able to freshly prepare all this kashaya on daily basis. So I opted for this kind of preparation where they will get the Triphala powder from the pharmacies, and they just have to mix it with the water and do the parisheka. That was opted.
Thank you there, Dr. Vishnu Priya. So that was the format used here. Very simple medications, external therapies, only managed through external therapies. Say the Shastra tells, Ayurveda classics tells that certain diseases, in Kushta especially, when we are dealing with skin diseases and complicated skin diseases, be it Shudra Kushta or Maha Kushta, the Shodhana, so that is the body cleansing or the purification, the detoxification, the modern day language uses detoxification for that, flushing out the doshas, and also the strengthening the tissues. So much of things are involved into this. Question to Dr. Vishnu Priyaji on behalf of all of us is, why did you think that I'll keep up with the medicines and just try with the external therapy? That was a courageous attempt. So why not even a single medication was included in the format? Was it because it was difficult for the parents to administer, or at 11 and 13-year age group you are looking at the palatability and acceptance of the children, or the busy schedule of the school children because they might not be able to take the medications? So this question is common to whether a mild cleansing like a Shodhana or like a Nitya Virechana or some medications, oral medications, Kushtahara medications. Why did you not think about this? And since you have shown the photographs of the improvised condition also, that was also really appreciable. And what tips did you give to the parents to see that the condition might not recur, like the prevention of recurrence of the symptom? What caution did you give to the parents?
Sir, I had not opted for any of the internal medications. That was the reason behind that was because of the chronic condition that they have reported. So they had this condition from their 2 years of age, and they're already this one 11 years and 13 years. by now. So convincing them to take a treatment or take an internal medication is very tough in this condition, and they have already lost their hopes by this Ayurvedic treatments and homeopathic, Ayurvedic, allopathic treatments and homeopathic treatments that they have come across. So they have already lost the hopes. So again, if I give some internal medications, I felt that it is not going to act, because the reason is because of the AMA condition, and that might be because of their mental stress that they're coming across. We all know in psoriasis conditions, always the mental factor is to be considered. And if at all they are stressed about something, whatever medications we are going to give is not of any use. So I just wanted to convince them, and I just wanted to show them that some external therapies can reduce the condition to a little extent. And if at all it is not getting reduced, yes, I'll go for some internal medications as well. I had told this to the patient also, but surprisingly, I got the results from the external therapies itself. And even the parents and the students, both children were actually satisfied by this treatment, and they were happily telling me the response back. So that was one thing. And apart from that, I had told them the advice. Two things that I have advised them to the parents was, one thing was the proper mopping up of this Trifala Kwata. After the parisheka is done, proper mopping has to be done. I have told them, because if at all some water content is remaining there, and on top of that this grita is applied, then again it is again chances for triggering. So this thing. So that is why I have told them to mop out the Trifala Kwata after the parisheka and ensure that it is properly dried, and then only the Shatatauta grita is being applied there. So that is one thing that I have advised them. Another thing was about the food. So I have told them strictly to avoid all sorts of katu, amla foods. So whichever that is going to trigger this psoriasis. And I have told them to avoid the fish as well, specifically prawns and other seafood items, which may trigger some immune responses. So that also was told to be avoided. And the minimal consumption of milk and milk products. So that was another thing, just to keep a check so that this is not popping up in between the treatment. So they had found some relief after following all these instructions. That is it.
Yeah, so here Dr. Vishnupriya was mentioning about the avoidance of katu and amla foods. So here katu is the pungent type of spicy foods, and amla is sour foods. And one more thing, so as she said, the conditions have worsened. So it was a point of concern for the parents to get some sort of the remedy. And without internal intervention, if some external therapies are given, so the parents will be happy, the kids also will be happy. There is nothing like popping up and also drinking some kashayams and other things. Jairaktuji has asked the question, the treatment protocol seems simple. Will this work even in chronic conditions as well?
So the condition that we have discussed is already a chronic condition. That is the best example that I have given. So a chronic condition in the sense they have this complaint from their 2 years of age. So now they are 11 and 13 years. So it is actually a chronic condition itself that treatment protocol has worked in it. But it may not be same for other individuals, because Ayurveda still stresses upon the fact that it is individualistic. So we have to plan the treatment protocols based on the individual's prakriti, agni, bala, everything. So we have to consider all these things and then administer. May not be working in other cases, but this case, yes, it has worked.
Yeah, so here the indications are very specific. As she made a statement that it might not work in other cases of psoriasis as well. That is why we are not trying to understand different types of psoriasis in this particular presentation, because it is a case presentation, one-to-one basis, dual case study. That's what we are trying to study here. So we are only focused towards discussion of this particular cases without exploring the depths of the Shastra and also understanding its Ayurveda equivalents and other things. So here is, we have a diagnosis, Dr. Vishnupriya. So when the case came to you, was it already diagnosed? So because since then they have gone through the modern medications, the doctor should have written some diagnosis on the case paper, like Palmar psoriasis. Was the diagnosis done, or was it treated? as some other condition?
I don't know, sir. I have not seen any of the clinical reports because they said like they don't have the reports right now. It was done very long. And then they had resorted towards homeopathic treatment. But still, they don't have any of the reports from them also. So they had just the pills what they have been taking. So that was there. And apart from that, they said like nothing is curing it properly. That was the only thing that I have. I didn't have the clinical reports also. So just it was confined towards one particular area, and that too it was the feet. I just thought about the plantar psoriasis. If it was extensively on the body, I could have thought about other diagnoses as well, but here it was confined towards the feet, so I thought about plantar psoriasis. And the presentation also, psoriasis signs like hospit sign, dental grease sign, everything was there, so I had chosen the psoriasis in it.
That was also really appreciable on your part that you asked parents to do those tests and give the test
Yes.
reports for you. Coming back to Jai Raghuji's question, two more questions. I'll club those questions for you, Dr. Vishnupriya.
Yes.
Also, how many days was the Parisheka done? Like how many days it was done? And what would be the Triphala and water ratio? How much ratio? So these two questions I've clubbed it for you.
So here the Parisheka was done, actually told for 7 days. But after by fourth day or fifth day itself, they started noticing some remarkable differences. And after that, by the end of 1 week itself, they had drastic improvement, and that is how the pics have been taken. So that is 1 week span. After 1 week span of this treatment, they had remarkable improvement in this symptoms. And apart from this, they are even doing now also. So that is what they are really convinced with the treatment, and they said like they'll continue this for some span, and later they'll stop this and try whether it is working. So that is one thing. And talking about the Triphala and water ratio, so here I have already mentioned it is a prepared Triphala powder which we have bought, which I have told them to buy it from some nearby pharmacy. So that was suitable amount was taken to mix it with the water they have chosen. Like if it is since it is used for Parisheka, you already know it might be a large amount of water. So based on that and based upon their financial capacity, they can opt what is the amount. So extremely small amounts can give no effect. So here it is like half of the packet was taken for each time. So half of the packet was advised in quarter of this bucket, and it was mixed. And then I told them to do the Parisheka. And I said, if it is possible for them to afford, yeah, they can go for again preparing of another Triphala Kashaya and do the final Parisheka and finish off the procedure, mop it off, and then apply this Shatadauta. That was advised.
Second part of the question was Triphala and water ratio.
So usually if we are trying to prepare for a fresh Kashaya, I would say Triphala, that is all the 3 ingredients taken, to be taken as one part. So if one part of this drug is taken, you can take 8 parts of or 16 parts of water, reduce it to 8 parts. That is also possible. Otherwise, you can take 1 part of this drug, 8 parts of water, and then reduce it to 1 by 4th. So, 1 by 8th or 1 by 4th can be done. So that is also possible. So there are different ratios for preparing of this Kashaya, and based on the purpose, we are deciding the ratio. So here I didn't want to complicate the procedure, so I just told them to prepare it like this and do it. Because convincing them through this online consultation is also a very big thing, to convince them, to tell them this procedure, and hearing the procedure itself, the patient parties might back off from this treatment. So that is one thing. So I just didn't want to complicate these things. I just gave them the simple procedure that they can follow.
And one more question related to that is, was the Triphala Kvata used, Parisheka was used cold, warm, or considerably hot? And for how much time it was done in one sitting?
So it is the warm Triphala Kvata is not advised in this condition. The reason behind, because the people, children were complaining about burning sensation, and also there were fissures in that area. So it is very much not advised to use the lukewarm water or the warm water. So here I have advised only the normal temperature water, and if possible, after 2-3 days of doing this procedure, I said if possible, you can opt for lukewarm water also for this procedure that was advised.
We have a question from Swapna ji. According to Charaka Vaipadika, I was about to touch this point. So because Vaipadika also manifests in a similar way, Panipada sputanam is there. So there is cracks and fissures in both hands and feet. But one more condition is Tivra Vedana. So there will be severe pain in this particular condition. Going to Swapnaji's question, according to Charaka, Vaipadika is Vata Pitta Hetu, but I haven't noticed erythema or inflammatory signs in the picture. And also it seems like you have advised the diet and treatments Pitta specifying, like anti-Pitta diet and treatments. Just wondering if there were any Pitta symptoms.
So Vaipadika, yes, we have to consider about Vaipadika itself in this condition. It was a Vata Pitta predominant condition, so we have to go for Vaipadika itself. And talking about the erythema, yeah, it may not be possible to elicit in the picture, maybe because of the light variations that they have encountered while taking this picture. So that might be the reason. Inflammatory signs, it is there are two types of inflammatory signs. So it might be possible to elicit externally, it may not be possible also. In this condition, there was inflammatory signs. Like they were telling, there was raised temperature, and also there was redness, they had mentioned, and they had also mentioned about the burning sensation. So that is one thing. Then also it seems like yes, so that is why I have told them to consume the foods that were that was pitta pacifying. That is why I have advised them such kind of foods and drinks. So talking about the pitta symptoms, so in what exactly is the concept about pitta symptoms? It is not actually about the redness and all these things. The patient was telling like they had burning sensation, but is it actually seen outside? No, it is the patient's feeling, what they say. So yes, they were presenting with most of the pitta symptoms, and the redness was also there in the picture. In one of the picture, it was clearly visible. The first picture which I have shown is clearly visible that there was mild redness, and both of them were complaining about the burning sensation, which is clearly a sign of pitta.
Okay, thank you there, Dr. Vishnupriya. So sometimes we need to see about the Pradhana dosha and also the Anubandha dosha. So at the time of our diagnosis, there may be some small dosha intervention. With the dosha which is not a causative dosha may also intervene, and sometimes its symptoms may become predominant at the time of diagnosis, like a Vata Kapha condition may have the Pitta symptoms. At the time of our diagnosis, the Pitta inflammatory changes may be there. At that particular time, it is very ideal to address the associated Anubandha dosha also, as much as we are trying to address the Pradhana dosha. So these things also should be taken into consideration. I think Swapnaji's question has been answered. Sandyji has a question again related to the quantum. Approximately 50 grams of Triphala Churna in 1/4 bucket of hot water, or 25 grams.
25 is too less. 50 grams or 100 grams have to be chosen. So 100 grams, it is based upon their their affordability of that treatment. So I have told them to take half of the packet which they purchase. That was advised. 25 grams is too less for this condition because they have to do the wash.
And Sandyji, I guess the size of the bucket also matters here. What type of bucket we are taking. So rather than speaking about the bucket, we may speak about how many grams to how much ml or how much water we need to take. That should be so. As Dr. Vishnupriya ji said, you can go with 1 into 8. So just multiply by 8 and use that quantum. If you don't understand anything, the quantities, so that shall be easily done. So that answers the question. So one more thing, Dr. Vishnupriya, you said one was at the score of 4 and another was at the score of 2, according to the score pattern. So did the relief also take like the child who was having 4 score took a longer time for recovery than the child who had 2 score?
Both pictures were sent on the same days. The first day of treatment, both pictures were taken on the same day, and the last pictures also was taken on the same day. So which reveals that it was acting on the same span itself. That was the identification.
Okay, so again, this Ekakusta, Kitiba, Vaipadika, so many things can be taken into consideration, Dr. Vishnupriya. And also there is a condition called as Charmadala, so which is Kapha Pitta association. It also has similar conditions, but there will be redness, there will be itching, there will be oozing, as we see the classical symptoms. Slight differences between Ekakusta, Kitiba, Vaipadika, Charmadala, and all those conditions. My last question is, tentatively last question is, can we go with this approach in either of these conditions, or in which conditions we should not use this combination of your combination of Triphala Parisheka and Shatadauta Grita application? Seeing that I'll come back to Charmadala. So here there are more of Pitta symptoms as much as Kapha. So there is redness, there is tenderness also. Sparsha Sattva is there. There is oozing also in Charmadala. Yet Galatati, so there is separation of the skin also in this particular condition. Almost like Ekakusta, Kitiba and Vaipadika, but over a severe grade, when we see that oozing and tenderness is also there, the person doesn't even allow the touch. So added question is, where we shouldn't be using this combination, number one, as a contraindication. And if there is oozing, if there is some fluid exudes which are coming from that particular lesion, can we still use this combination or not?
If there is oozing or in such kind of conditions, we can opt for another Kashaya combination, which is, instead of Triphala Kashaya, I would go for Arakota Kashaya. So in that cases, and I have done it practically. So that has given tremendous improvement in this in the condition where there is itching, and also when we need to reduce the erythema kind of conditions. So in all these conditions, we can give Arakota Kashaya. Arakota Phalamajja Kashaya was chosen for that condition. So it has given tremendous improvement, and I could not take the images of it because it was in the gluteal cleft region. So I could not take the images of it, but actually the person had told that there is tremendous improvement in that medication and that thing. And talking about, if there is oozing conditions, you should not go for Grita applications or any of the things. We can opt for Marichadi Taila or something, but still, if it is actively there, then no, it is not advised. And once the oozing and all things have reduced or subsided, then we can go for Marichadi Taila combinations. Otherwise, it is not recommended, I prefer.
Well, so that's also a very interesting answer there, Dr. Vishnupriya. And see, we have seen a very close relationship between Kushta and Vatarakta. In Vatarakta conditions also, there may be some skin-related conditions as we see in Kushta, and in Kushta also there may be joint-related conditions as we see in Vatarakta. These are wide-spectrum diseases. Vatarakta manifesting with these conditions. So can we go with this similar, because Shatadauta Gruta is also appreciably seen in painful and burning conditions as in Vatarakta. So having some skin related conditions like fissures, cracks, etc., Twadgata, or so little deeper tissues, can we use this combination? Or
Yes,
would you avoid Kashaya there?
You can go for Kashaya. So this Kashaya combination can be used. Apart from this, we can go for internal medications as well. If it is more, we can go for internal medications. Any of the blood purification Kashayas can be used. Like for example, Mahamajishtadi Kashaya is a very good option in this case. And even Guduchi Kashaya also helps. But more, I have found effect in this one. Mahamanjishtadi Kashaya has found very much good effect. And apart from that, Kanchanara Gukulu can be advised, and Arogya Vardhini Vati also can be advised in such cases. It gives good effect.
Thank you, Dr. Krishnapriya. Okay, if those two kids were obliging, like they were okay with taking oral medications, what would your prescription be?
If they were obliging towards the condition, like taking the medications, I would go for Avipatikara Churna can be given in the night time, like a half teaspoon with lukewarm water can be taken in the night times, and morning and evening I would advise them to go for Mahamajishtadi Kashaya. I think this will give good results because it has proven effects in other patients also, this combination. So that is a very good prescription, but it is very bitter. So I don't think the kids might get, yes, that is it. So if it is okay for them, then yes, sure, they can go it. go for it.
Finally, before winding up the session, so one more important point I would like that since we are speaking about Kusta, we as Ayurvedic doctors might see a Krimi component there, and
Yes.
especially when dealing with the kids. So is it wise enough to consider Krimi in these conditions might be one of those positive factors, or a trigger? You are mentioning so many triggers. Should we add up something for the Krimi? So because it is a general practice that the Krimi is a concept which is neglected in the clinical practice, and many times the Krimi-Hara medicines will give very good results in the skin conditions.
Yes, sir. That is also finding a very good effect in treating the psoriasis conditions. But here I had asked them particularly whether they are, as they are of the child age group, I just asked them, like, are they taking more of the sweet products? So they had denied such a history. So they were actually going in Pathya way itself. So whatever food histories that I have asked, they have denied all those things. So I just thought like that might not be the reason. But yes, if they are taking more of the leafy vegetables or such kind of food, again we have to think about this creamy concept. But still, that also was denied. They don't stick on to some particular kind of foods. That was the specialty in this family which I have come across. So they didn't stick on to one kind of food. That was the thing. So I didn't think about the creamy concept there. But yes, in some cases, even that has to be considered while treating the psoriatic cases or skin disorders. So once we do the Amapachana, so whatever things that we give for Amapachana can act for Krimi also. So that is the thing.
Thank you, Dr. Vishnupriya. In short, what is your advice to today's kids, the students who are graduating and coming out and having big ideas of practicing Ayurveda, but they're not sure where and how to start with? What, as a teacher, Dr. Vishnupriya, so what's your advice to the kids?
So my advice would be like, it is not always the slokas that you read about in the samhitas. It is like reading between the lines. Once you read about the sloka, you need to understand what is the practical aspect of it. Sometimes it is like a wonder, like you may try out like this, like you might have read that Arakwata Falamajja is good in Kushta. You need to think like in a broader aspect, like, okay, we'll make some Kashaya, we'll try this in Kushta. So that researcher should be there inside us. That is one thing. Another thing is like apart from the Chikitsa Sutras, there are other things that Acharyas have mentioned, like in Bhavaprakasha's and Bhavaprakasha text, there is some concise versions of treatments also. So that is also another thing that we can test in patients. So every patient is actually a test itself. So within 5 minutes, we have to diagnose the case, we have to design the treatment also, and we have to interpret the results, whatever things are there in their lab reports, everything has to be done within a span of like 5 minutes. So it is actually like we should gain more information both in modern aspects and also Ayurvedic, so that we are well updated about what exactly is the pathology of the disease. And even if we don't know the pathology also, it's fine. We just have to know what exactly doshas, which doshas are getting vitiated, and choose the suitable medication. That is it. So there are formulations, and the students don't know how to select the formulations exactly. So there are formulations where there are indications specified. So there is a n number of list which is giving many indications, and the students are not able to opt a suitable formulation. The technique behind choosing a formulation will be that combination of diseases. So in case if you find that combination of such diseases in one person, you can opt for that formulation instead of going out with the n number of other medications. You can go with one formulation which can cure all these things at one go. So it is not like prescribing 10 medicines with all those internal medications and all these things, dumping with many medicines and creating more armor to the patient. No, we can make it more concise by giving this one formulation kind of treatment.
Thank you there, Dr. Vishnupriya. So I guess we have come to the conclusion of the session. So this from this particular class of Dr. Vishnupriya, Easy Ayurveda Gurukula, we carry a message like we can be simple, still effective. Thanking all our participants on the Easy Ayurveda family, and a special thanks to Dr. Vishnupriya. I would like to conclude this session here. So until we meet the next time, So thanks, namaste, and loads of love to everyone. Namaste.